Welcome to week 6. We're going to be discussing the treatment of bipolar disorder. So looking at the prevalence and the types of bipolar illness. So bipolar illness is a disorder of mood regulation characterized by cycling between high highs, so call that mania, and low lows or depression. So 3/4 of the patients will fail to maintain treatment within 5 years. So unfortunately, a considerable amount of people will stop taking the treatment as prescribed within 5 years of diagnosis or maintaining treatment. 1% of the population will have a bipolar diagnosis, so a lot of people will have this. But when bipolar spectrum disorder is the diagnosis, the prevalence increases up to 6%. Average age of onset is about 18 years of age, with their first manic episode happening around 24 years of age. But the age of correct diagnosis, it takes another almost 10 years to determine a bipolar diagnosis. So it does take a long time to figure out what the actual diagnosis is. Bipolar is thought to originate endogenously, so within the person, but can be triggered by exogenous or environmental stimuli. So therefore, the mainstay of treatment is medication. So somebody who's diagnosed with bipolar, the main treatment would be a medication. Psychosocial stressors may trigger a patient to cycle between low and highs in someone who is genetically predisposed. So there are many different types of bipolar disorder. So bipolar disorder 1 is a manic features with depressive features and mixed mood states, meaning having both symptoms at the same time. Bipolar type 2 is similar to type 1, but limited to hypomanic states only, so not as high a high. Cyclothymia is a milder form of type 1. It cycles between hypomania and a low-level depression, so it's not as extreme. And rapid cycling, it's occurrence of 4 or more episodes of mania or depression within 12 months. So that is a significant amount of episodes. But the most common cause, looking at the uncritical use of antidepressant medication, so causing the rapid cycling. Some other causes of bipolar disorder. So it's related to neurotransmitter dysregulation or possibly the abnormal permeability of the postsynaptic membrane, meaning there's something that's not working well between the two synapses, or the synapse between the two neurons, so the neurotransmitters aren't passing through or working properly. Most exclude medical issues that might You must exclude medical issues that might cause or contribute to a patient's cycling mood disorder. So some examples might be a brain tumor that might be causing changes in mood, could be a delirium, Huntington's disease, hyperthyroidism, cancer, multiple sclerosis, Parkinson's disease, and stroke. Medications and substances are known to cause or worsen mania. So for example, antidepressants, if somebody who has a bipolar diagnosis is given just antidepressants as treatment, it could actually trigger somebody into a manic episode. Corticosteroids, other drugs, so any stimulants and some hallucinogens, and opiates can trigger a manic episode. So I'd like you to pause now. I know some of you're having a hard time viewing the films on demand, but I really feel it's important that you watch these videos. So I'd like you to take some time to go to the Fleming Library site, search for the video Mood Stabilizing Agents, Psychotropic Medications. It's from 2014. The producer is Classroom Productions, Inc. It is only about a 20-minute video. So pause now and I'd like you to watch that. Counseling and psychotherapy. So patients will most likely need some psychotherapy when they're stabilized on medication. So it will take some time to stabilize on medication so the moods aren't switching and are more in the middle range. And then psychotherapy can be useful. Suicide risk assessment should always be done part of an evaluation, always. Patients diagnosed with bipolar disorder have higher rates of suicide risk because of the erratic and chaotic mood swings and behaviors, so it's harder to predict. Therapists should start with addressing family education. Most families have little understanding of symptoms, behavior management, and causes and treatments. Family therapy should focus on establishing a safe environment and constructive communication and solving problems together. The person may benefit from individual therapy to help understand the illness, accept the diagnosis, because some people might not believe they have the illness, don't believe that they have manic episodes because some people don't remember that they might have been manic, and then learning to manage the chronic nature of the disorder, because this is unfortunately a disorder that isn't cured. So some types of therapies might be psychodynamic, cognitive behavioral, and solution-focused therapies. So some medications. So there's looking at mood-stabilizing medications. There is a link here to CAMH regarding treatment of bipolar disorder I'd like you to take a look at. There's really three categories of mood stabilizers: lithium, anticonvulsants, and atypical antipsychotics. So lithium stands alone as its own category. It's used as treatment of acute mania, so when somebody is in a manic episode, and then also maintenance therapy to prevent cycling. So it would be taken over long term to stop somebody from cycling into a manic episode. Manic and depressive phases of bipolar can be treated with lithium, so it is for both ends of the spectrum. So lithium's mechanism of action is unknown, but there are multiple biochemical effects, including the increases synthesis and release of serotonin, so there's more serotonin. It increases norepinephrine in depressed patients. It decreases norepinephrine in manic patients, and it blocks dopamine. So it's hitting three different neurotransmitters when it's taken in a patient who's diagnosed with bipolar. Lithium is a salt in the body. Lithium concentration is determined by the patient's body fluid system. So if the person is dehydrated, it might lead to a toxicity. So it'll be too much of the lithium salt in the body, so need to make sure they're not dehydrated. And the therapeutic level, so what is effective for the person, is really close to the toxic level. So you need to be very careful. So most common side effects, so thirst, because it is a salt, increased urination, rash, tremor, dry mouth, increased appetite, weight gain, nausea, bloating, diarrhea, edema, and thyroid dysfunction. So side effects can be diminished by taking doses throughout the day, so taking a little bit in the morning, a little bit at daytime, a little bit at night, as opposed to one larger dose. Lithium toxicity may cause renal failure as well, so being very careful and needs to be monitored closely by a doctor. So therapeutic dose, the range is from 600 milligrams to 1200 milligrams per day, and blood work is needed before starting the medication and then every 6 months to check the levels. So some things to look out for signs of toxicity, looking at ataxia, poor coordination, slurred speech, poor attention span, severe tremors, nausea and vomiting, lethargy, arrhythmias, hypotension, seizure, coma, and potentially death. For somebody who's pregnant and taking lithium, there is a moderate risk associated with heart malformation in the baby. So the next type of medication for bipolar disorder are anticonvulsants or anti-seizure medication. So these are medications that would be prescribed to somebody who has a seizure disorder, but they also are effective in people who have a bipolar diagnosis. So valproate, also known as valproic acid, it's useful for people with rapid cycling, have atypical features of bipolar or mixed mood states, meaning both depressive and manic symptoms at the same time. It is a treatment for acute mania, so somebody who's in a manic episode. There's side effects: nausea, diarrhea, hair loss, rash, weight gain, and tremor. And for this one, they also need to do laboratory blood testing to check levels, and it's advised not to use this during pregnancy. Tegretol, it's not approved as used as a mood stabilizer, but it's found to have that effect. Some side effects: rash, fatigue, nausea, dizziness, sedation. Again, need blood test, and there's a high risk during pregnancy for the fetus. Lamotrigine or Lamictal. So this is an approved treatment for bipolar disorder, and it's best for bipolar depression. Some side effects: so toxic rash, headache, seizure, sedation. But there's an unknown effect during pregnancy. Gabapentin, known as Neurontin, primarily used as an adjunctive treatment for bipolar, so it's added to another medication. It's not been approved for this use, so there's not been enough research, but it is showing that it can have an effect. So the side effects: sedation, tremors, nausea, dizziness, and weight gain, and again, not recommended to be used during pregnancy. Topiramate, it's also known as Topamax, does not have approval for bipolar disorder, does not cause weight gain, but the side effects do include weight loss, sedation, cognitive dulling, fatigue, headache, paresthesia, so numbness in the extremities, and again, not recommended for pregnancy. Other anticonvulsant medications, tizobine and zonisamide. These are similar to the above medications, and they're being researched for use with bipolar. Oxcarbazamine, it's similar to others as well, but have less side effects. More research needs to be done for the usefulness of bipolar. Clonazepam, it is a benzodiazepine. It's used in adjunctive medication for patients who do not have a history of addictions. So this medication can be added to other medications. Olanzapine or Zyprexa, this is also a treatment of acute mania and psychosis. It acts as a mood stabilizer and antipsychotic. It also comes in Zydus, which is, it disintegrates. It's a tablet you put in your mouth and it just kind of dissolves. So somebody who is maybe too psychotic to take another medication, you can take this. It's a fast-acting medication to calm somebody. So side effects: sedation, weight gain, constipation, dry mouth, dizziness, orthostatic hypotension, again, standing up and your blood pressure drops, and weakness. You need to have laboratory testing for glucose, lipids, liver function, because of the likeliness of diabetes. Again, do not take this during pregnancy. Simbex, this is mostly for the depressive phase of bipolar. It can be combined with medications like Prozac or olanzapine as well. Risperidone, also known as Risperdal, treatment of acute manic or mixed episodes. Again, has an orally disintegrating tablet, so it can melt in the mouth. Side effects: restlessness, insomnia, constipation, dizziness. You need laboratory monitoring with this one as well, and then, again, not during pregnancy. Quetiapine or Seroquel, to treat acute mania, again, same types of side effects, need laboratory monitoring, and again, not for pregnancy. Ziprasidone, for acute mania with or without psychosis. It's not approved for bipolar, only for schizophrenia at this time. Can cause potentially fatal arrhythmia, so a heart arrhythmia. So some side effects: somnolence, dizziness. Oh my god. Dizziness, rash, anxiety, nausea. Laboratory monitoring, need of glucose and lipids and liver function. It's not recommended for pregnancy unless the potential benefit of the mother outweighs the potential risk for the fetus. It's something to always look for. Aripiprazole or Abilify, this is one of the newest atypical antipsychotics. It's effective as a mood stabilizer for acute manic or mixed episodes. Side effects: headache, nausea, insomnia, somnolence. You need laboratory testing, and it's not recommended for pregnancy.